There we go. Okay, so sorry for the repeat. This is Sarah Beth Laurie, and today is our first session of summer 2026. We are focusing restorative justice, harm in the Washington carceral system, and we are lucky to have Dr. Maxell here, a faculty member and community leader with lots of experience around these issues and many more, which I'm going to ask her to start us off with. Thanks, Dr. Max.
Awesome. Thank you, Sarah Beth, Dr. Lordy. Hi, everyone. My name is Dr. Max. Max is perfectly fine. Um, yes, my background is pretty extensive. I've worked in the carceral system, around the carceral system, for quite some time. And now I am the director of a co-occurring treatment center in Seattle, Washington. Working with individuals who are justice involved. Um, Prior to all of this, and I will tell you, I never saw my life and my career taking the path of working with individuals in the carceral system, not for any rhyme or reason, but I always thought that private practice would be something that I would stick with or working in schools, but realized that a lot of the justice work is sort of where I am now and working in restorative justice, which we're going to be talking about today. I have so many stories in terms of the clients that I've worked with and some of the legislation around the work that I do. But I think the most important is what I've learned throughout this whole process about what we need in terms of leadership and progressive change overall to help serve these individuals. And that's really the big portion of restorative justice, understanding the narratives, really sitting with these individuals and catering to and learning about their individual needs, right? Because not everyone that goes through the system needs the same thing, and they haven't all been affected by the justice system in the same ways, and that we can't use a cookie cutter approach. And this has been part of the issue for so long.
Thanks, Dr. Max. Holly, before we move into our dive with this conversation, is there something you wanted to mention? Or maybe just your hand is up still. Feel free to stop us if so. Okay. Well, I am excited to just start in the place of just creating context with vocabulary that is going to come up in this conversation. Um, your work explores both iatrogenic injury and lexigenic injury. Please explain what are these words and why are they important to understanding harm that's happening within the Washington carceral system.
Yeah, so these terms summarize a lot of what we know. We just haven't necessarily put a term to them. So iatrogenic injury has to do with systems that were created or put in place to help people, and particularly in this system, in the carceral system, to effectively become independent and autonomous, but can create or continue harm, actually, right? So the carceral system is a punitive one. And I don't think anyone would really disagree. I don't know that we here in the United States and even in Washington have fully grasped how punitive the system is. And a lot of it has to do with mentality, right? So it's a very morally injurious system for both the service providers and for the individuals who are participating in both voluntarily, involuntarily in the carceral system. Uh, and so, the best example I can use is you go to a doctor's office, right? And oftentimes we see doctors as helpers and healers. Now, depending on how you're historically situated and your engagement with the medical profession, you may or may not have or share that way of thinking. But you go to the doctor because you are symptomatic of something, right? Your stomach hurts or your head hurts or you're dealing with chronic pain, you go to the doctor and It's in many ways, it's a very prescriptive um, system, right? So you go to the doctors, and likely what will happen is you will either end up with a referral for consultation with a specialist because perhaps this individual that you're seeing doesn't specialize in that area, or you'll leave with a prescription, medications, or some other form to that's meant to alleviate whatever your symptoms are. And we've argued this for a long time that part of the issue with allopathic medicine, or how it was, is that we treat the symptom and we don't treat the actual problem, right? And we see this a lot in psychology, and we see this in counseling as well. But what happens, right, when you go to the doctor and then everything goes as planned in terms of you leave with this prescription, this medication, but then your symptoms worsen. And that's what happens in the carceral system. That is the iatrogenic system, where the interventions, or the very systems, right, that are created to help either society or help the person, cause more harm. And so we have this, in essence, transgenerational trauma that continues to ensue. And while we try and sort of poke holes in this system and try and figure it out, there's so many moving parts, right? The goalpost is constantly moving, from a political standpoint, from a social standpoint, from a personal standpoint. And so that is sort of like a globular kind of look at that particular term. The second piece, lexigenic injury, is something that I think in the field of psychology and counseling, we are super familiar with. If I said the term words matter, this is lexigenic injury, right? So what we call people, the verbiage, the terms, the terminology, what we say when we call people inmates or offenders, or, I am a substance use specialist, professional, and we are deviating from the term addict because it has a very negative connotation, right? This is why we no longer, in the state of Washington, and I believe it was around 2018 when we made this change, we went from calling them chemical dependency professionals to substance use disorder professionals, right? To go along with the DSM as well. And what we have termed as more politically correct. And so it's this idea that when people come out of the carceral system, or they are, it's this revolving door, this almost pipeline from jails to prison, or the streets to jails to prison, we assign them a name, and those names travel. Think about in the field of counseling and psychology. If you've ever been diagnosed, or at a doctor's office, I'll go back to this example. Many people don't know. Every time you go, especially for insurance purposes, you are given a diagnosis. Whether or not you are aware of said diagnosis, you can go back and request your medical file and ask for information as to what you were diagnosed with. But every single time, even if it's a continuation of the last diagnosis, you were given a diagnosis. And what we've in effect done is we have diagnosed, or we have assigned and designated people what we think they are, based off of the behaviors that, perhaps they put out in society, right? So um, the term felon is extremely harmful. And like I said, offender, inmate, ex-con. These are terms that we are deviating away from in restorative justice. And so when you have systems, right? So this iatrogenic part, when you have systems that are causing harm, and then those systems are also utilizing words against these individuals that also cause harm, you can sort of see the overlap, and how it can be a really hard cycle to break. I think you're muted, Sarah Beth.
I was born today. Thank you for talking through this. It was bringing up for me that the power of judgment, and
Mhm.
how our judgment like holds us in a place that might not need to exist. And when we let go of old terms and old words, that we have new opportunities to shape new relationships, but also to see people differently, to imagine new possibilities, and to provide support instead of maybe saviorism
Mhm. Mhm.
um, or continuing patterns of harm
Yeah.
because we can see the picture uh, more broadly, more widely, but also more deeply because we're listening to somebody instead of putting someone in a hole.
And
And yeah, go ahead.
I think that's the hope. And I'll sort of play, I don't know that I want to say devil's advocate on it, but I think with restorative justice, the hope is that we can educate people or that people will do the buy-in to learn more about the circumstances of individuals going through the carceral system. And I'm not just talking about those who are affected immediately by the law, right? And so just to put this in colloquially, put this, those who are locked up or about to be locked up. But the mindset and the mental health of those of us who are serving those populations, it has really, and it can have some really devastating effects, both seen, unseen, noticed, and unnoticed. Um, and we hope that the terminology brings to light the opportunity and opportunities for people to grow and learn and actually contribute positively back to these systems and help to break these chains. But also politically, where we are, it's a bit questionable. It's a bit questionable, right? What we're hearing is a lot of archaic terms. We're seeing a lot of archaic laws and procedures come back, and it makes um, transformation and growth really, really difficult. But I think for those of us who are invested in the betterment of society overall, it can be an opportunity. Um, there's a lot of listening and I think a lot of self-reflection that needs to happen on all sides um, in order for this work to be more meaningful than I think it is in the present time.
Yeah, thank you. Throughout your career in corrections, what are some examples of well-intentioned policies or practices that inadvertently create barriers to healing or recovery or successful reentry even?
Ooh, okay. I mean, there's personal notes, and all of this is personal in terms of the work that I've done in corrections, um, and then sort of more on like that bigger scale, and as we see it across the board. So on a personal note, when I look at some of the in-house policies, right? So um, I worked for the Snohomish County Sheriff's Office, and I absolutely loved my time there. I learned so much about the inner workings of a jail and pretrial, and also, it really helped me to grow and develop as a professional. But and I don't think that this was ill intention. I think this was a more restrictive in terms of resources. So there were very few MHPs or mental health professionals versus the number of individuals that were, housed in the jail. And some of that is funding, right? Some of that is also it's pretrial, so it's much more transient population. So, you have some folks that are in for less than 24 hours and they're gone. And that's a missed opportunity sometimes, unless there's attention that's sort of being drawn to any observable mental health concerns or things that are said verbally. And then there are folks who are there up to, 364 days, or it really just depends on if they are waiting on consecutive or concurrent kind of, waiting for sentencing, things like that. So as a mental health professional, it was hard because there's one of me and there's a ton of them. And even with my work, sort of during the pandemic era, even though we were not fully housed because we wanted to maintain safe standards and all of that, uh, there was still such a high need. And there were times where I saw a few people a day. And then there were times that I saw a ton of people. And it's just really hard because one, you're walking everywhere. Two, there are certain individuals that you need to speak with, and it depends on how they're classified. So, for those of you who are not aware, there's a classification system in terms of how people are housed, based on not necessarily charge, but sometimes risk, or mental health status, or what have you. Um, and there's several pieces that go into classification, and it's not just the classification committee. There's mental health professionals and correction sergeants and lieutenants and stuff that go along in this meeting as well. And so it is a very thoughtful process. But there are several individuals who uh, need help and need assistance, and they'll send communication through what we call kites. There's a kite system, and that are requesting mental health services, and sometimes you just can't get to them. And yes, it's not necessarily policy, but it's procedure, right? It's just that there's so few of us. And then sometimes, in I guess in the name of safety, uh, there are certain custodial things that need to happen that will absolutely trump what we can do in terms of mental health because of risk. And so even if we see things from this lens, from a safety perspective, that's not necessarily our job. And this is where custody kind of gets involved, and they have to keep.
Max, can you give us an example?
Yeah, well, so we had, a situation where, and this happens, especially when people come into booking, if they're under the influence or what have you, and it would make sense if we had a mental health professional come down and speak with them. And I remember this on several occasions where, we say they're coming in hot. They're coming in, they're angry, they're upset, they're under the influence, um, and they don't know why they were booked in, or they say they don't know why they were booked in. It's inconvenient on all sides. And next thing you know, they're at the pat down wall, and they're angry because they people are touching them, and perhaps there's a lot of profuse trauma there. But um, the officers have to manage risk. I can't get in the way. And at the same time, I can help provide context. But I have to find that window of time. And sometimes, unfortunately, that window of time is once we've either exhausted them, and we've gotten them into a cell, or they're just angry. They're really, really angry. And I think in many ways, understandably so. And so trying to de-escalate them makes it really hard, where we could have had that opportunity right there. However, I'm also not going to risk, getting punched in the face, or my colleagues getting harmed, or other individuals that are getting harmed. And so the order of operations gets a little twisted. Um, and it makes it so, we people come in, and I have, told people and my colleagues this: everyone that walks through these doors has likely experienced some type of profuse trauma, especially if they're unhoused and you know, they've been on the streets for a while, or the jail, or, has been a revolving door for them. Or, they're being booked on several, for several charges, or there's, warrants in other counties, things like that. It makes it really hard when we can't sit down and have a conversation with folks about, hey, like, I understand that being in handcuffs is very difficult for you, because there is risk. There's flight risk, right? People running away. There's assault. There's all different kinds of things to consider. And I don't take that lightly, and none of us do and have. But it is in many ways a missed opportunity. It's a missed opportunity to learn about individuals. And on the other side of that, those individuals have to do some type of buy-in, and trust. So it's just like, which one is it? You know?
I, I'm I'm also thinking about our training here at the beginning of this ID program.
Mhm.
And at that time in our training to become psychologists, I'm not sure we learned about all the complexities of working in systems that you're bringing
Mhm.
up. And I
Yeah.
think about like all the different roles that are part of this kind of work and how every single role has different language for
Yeah,
things and how those roles put us in different judgment places. And
yeah,
the language that we choose to kind of go back to that piece about the language itself, the language can cause injury, can cause harm.
yeah.
And I'm curious, how do labels, like you mentioned, offender, felon, non-compliant, or high risk, how does that shape the way that people are treated
Mhm,
across all these different roles?
mhm.
And ultimately, how does that impact the way the person themselves sees who they are, sees
Yeah.
themselves in the system, if you don't.
It's a really interesting dynamic. Um, for some people who have done like hard time, right? Like this is not their first rodeo. They may, and I've experienced them addressing themselves as felons. I think I had to sort of check myself because the first thing I wanted to do was correct from that very social justice perspective. And for them, it's that is who they are, and that is what they prefer to be called. And so there needs to be some questioning, and I don't mean in the interrogatory sense. It's more so is that how you identify, or is that no one else has given you the opportunity to be called something else? And for some people are like, what, felon is the term that I use because that reminds me of like where I am and what I need to do to straighten up and fly right. And so we have to be mindful, right? I think uh, in the beginning of our doctoral program, there was the information, by the way, is just so overwhelming. Learning, I mean, and we learn about systems and how systems were affected, marginalized groups were affected, things like that. But I would say, it took me 7 years to complete the PsyD. And even then, there's still so much to learn. There's still so much to learn. And then even after that, going into practice and doing this work, I'm still learning. And it's ever changing. Um, and I don't know that anyone just wakes up and dreams of being like a corrections mental health professional, but I don't know. I'm pretty sure they're out there. But I think sometimes with this work, we sort of stumble upon it, right? Because we think about social justice in very different ways, like advocacy and politics and legislation, and which is, it's not to say that that is all that we have experienced or that we have gone through, especially with our time at Antioch. But I think the carceral system is even in like the law enforcement world, people don't see corrections as law enforcement. Like I worked in law enforcement. It's and I think it's just a very different contingency. But the same is true for any institution that you are going to work for, right? There's going to be acronyms, there's going to be verbiage that may not link up to what you have gotten in your training at Antioch or what you're exposed to in this social justice model. And I don't ever claim that there is one social justice model, right? I think that there are iterations and that we're all trying to find a way and we're all trying to make it all make sense. And there needs to be more kind of coming together about it. But it profusely shapes, I think, how people see themselves. Um, if we address them as a certain term, then it's almost like they know that you know, they're likely going to be met with a level of respect or disrespect that either they're used to or not used to, right? I had a practice of calling those, in the jails by their first names, which for some of them was very disarming. They were like, wait, you're not going to call me so and so? And actually, it was a huge practice where we would call individuals by their last name. So there, it was, it was respectful in that we assign them their names. That is their name instead of like, inmate number, whatever. But I made it a practice to go by their first names and make it on a personal level. And I'd say, I'm Dr. Max, and this is who I am. And sort of lighten the blow so that they knew that I was an individual that was a safe space. But I think you're also dealing with individuals, officers, those who are in the cells that come from very different walks of life, ex-military, you know, tr trauma growing up. So childhood trauma, complex childhood trauma. You're dealing with individuals that were in different professions, the medical field and what have you. And I mean on both sides, whether you are a person incarcerated versus a person who's an officer. Um, and what we say and how we address them, um, it absolutely matters. But I also think what absolutely matters is that we ask them if there has been an opportunity to learn more about, the title behind that. Because if they're used to offender or used to X, Y, and Z, because I've never worked in DOC, however, I've done contract, work across the state and gone to several of the prisons. Um, I don't know what it's like now, but many of the folks that are, that have gone through DOC or, the Bureau of Prisons, there's a different cadence because they're there longer term. And so the terms that are assigned to them can be very different you know, um, from pretrial and being in jails. So when we don't keep a curiosity about us that helps us to learn who people are, I just don't think that we can appropriately help them with aftercare. I think because that's in many ways, that is our role, right? As, no matter what, working with justice involved individuals, our role is to help them to move through the system and hopefully be out on the other side. And what is in a name matters. It just absolutely matters.
Thanks, Max. I'm noticing that it's probably a little past time to start opening up to our audience here, and I would like to ask that people feel free to put your hand up or put something in the chat. Um, I also can think of a couple classes, and I know it's not limited to these two classes, but this quarter, for example, we have students taking the politics of psychology.
Mm,
And we have the Black Power movement, which are
mm,
both classes that are informing our ideas about systems and power and how we think about justice.
mhm.
Restorative justice is a term that is thrown about quite a bit, and I would ask first if you wouldn't mind, Dr. Max, to just describe what that means for people who are learning about this. And
Mhm.
then this model is asking us to think differently about accountability and healing.
Yeah.
And I'm wondering how adopting this restorative approach reduces these two types of injury that you started us off with, the iatrogenic and the lexigenic injuries within the system of criminal justice itself. Yeah.
Yeah, I think that this is probably one of the toughest questions to answer, and I'm going to take a stab. Um, when we think of restorative justice, we think of restoration, we think of restoring, but it's not necessarily in the sense that we may initially believe. Um, Restorative justice has to do with there's a surrendering of part of ourselves, a reflection. So we all have to be extremely reflective and look at our own implicit biases and what we're bringing to the table. It is not about a communal model in the sense of sameness. It is about respecting communities' rights to thrive. And so in effect, to restore them, we have to help them get to a place where they can actually do well in society without stripping them of what their cultural values are. And that's hard. That's extremely hard because we place our agendas on people whether we believe it or not. Right. Um, I've had several conversations with people about just even the term like Black versus African American. And I think it's like where you are situated in place and time. And this is what I say about it. I don't think that either term is wrong. I identify as Black. Um, and if we were to keep in the same sort of the same lexicon kind of journey, African American would mean that an individual immigrated into America, from Africa. And that is not my case. That is not what happened to me. However, I recognize that this has been sort of the trope, right? This has been what we have utilized. And so it's understanding people's principles and where they come from and how they are situated culturally. Uh, I go back to this idea of we don't have one social justice model, right? Because social justice is not we don't have a unified definition of what social justice is. Therefore, we can't have one unified model. Not yet. But restorative justice has to do with the policies and procedures that we put in place, the legislation that we put in place, the people that we put in place to enforce, to lead, to rejuvenate, to educate uh, all groups, other groups that are not the same, that look like us or smell like us or talk like us. And it goes back to the principle of preserving people's life, liberty, pursuit of happiness. And that all looks different across the board. The issue with that is there are people that don't want to surrender. There are people that don't, or they believe that they have engaged in that level of self-reflection. And self-reflection minus action does not equate to anything that is necessarily meaningful. So there's so much that we have to do. Like for me, it's not safe for me to assume that I understand all the needs of marginalized populations within the carceral system. There's so much that I don't know. Um, because in order for me to understand that, there are other parts of the system that I need to understand, which is I need to understand family systems and how family systems are affected by these individuals being incarcerated. And if I'm understanding family systems, I need to understand government systems. And so there's a huge educational kind of lacking. And people tend to focus on just kind of one area or one slice of the pie, and they zoom in on that. But we're not looking at how the expenditures across other systems and how they sort of trickle in. And there has to be a buy-in by multiple systems at any given time for any of this to work. All right. So like if you think about schools, and I almost said that this was basic, and I'm about to complicate this in the worst ways possible. But you think about schools are teachers and students, right? But it's not just teachers and students, right? It's also administration. And where there's administration, there's a board, like a governing board. And where there's a governing board, there's the community, and the board has to answer to the community. And if there's the community, then there's like, the feds, and then the feds have to help in terms of grant funding. And so it's sort of like that with restorative justice. It has to be an effective intermingling of several systems. And what we don't actually see, and I have seen, is all these systems have to be put in place and work effectively for even one person to get through. Like it is a multiple, there's so many different layers. Um, and I'm a part of the King County Reentry Work Group here in Seattle, and we talk about this. So we've got attorneys, we've got service providers, we've got corrections officers, uh, educators, people from different walks of life, all coming together talking about where the gaps are in the system. And we're realizing, oh my gosh, for one person to get out of this situation with matriculate through the system and get what they need, it takes literally all these systems working together. And if you can imagine, this is likely why it's oftentimes difficult or people don't do the buy-in when it comes to restorative justice, because it does require us to make a bigger footprint. It requires us to do more work before we get an established system, and then we can really start, getting people where they need to go.
What's coming up as you're talking about the complexity of this system is that our field sort of purports that with self-awareness, with self-reflection, change is possible. Change is gonna happen. And
Mhm.
I think what you're suggesting is really important, that with any system, uh, it may be true that that's possible. but without relationships,
Mhm.
without connections,
Mhm.
without understanding, that person who is locked up may not have a voice,
Right.
may not have power to
Right.
change their own situation or to see a way to
Mhm.
change their situation. And this is making me curious if you could
Yeah.
redesign one aspect of Washington's correctional system. What changes or change would you make to reduce that systemic harm?
Oh man, all axons are firing now. Whew. One thing. Oh, that's hard. I don't think I would start with uh, the carceral system necessarily itself, because then if you think about it, we're all a part of the carceral system. Like we every like
It
indirectly,
it's
we're,
tied to
we're
the history of our country for sure,
correct.
just as it's tied to slavery.
I
Yeah.
think that if I could, I would I would directly provide education um, to the public and not just have it sort of, it's not necessarily hidden away, but there are numbers and things that are somewhat indecipherable to the public, or um, you know, unless it's negative in terms of like an officer got assaulted or there was an overdose at, a jail or prison or something like that. There's not a whole lot of attention that's necessarily drawn to the world of corrections and then the carceral system, unless, once again, it's something negative. But we don't hear a lot about the success stories of what works outside of our sort of little esoteric bubbles. Because I work in it. So I hear about the great things and then the not so great things all the time. But if I think if the public was more educated, and I don't know that I know how to necessarily do this, but if we were just to even kick it up a notch and bring more attention to it, even starting with us as clinicians and providers, um, there needs to be, if you can't talk about social justice, I don't believe, unless you're talking about the carceral system and what is punitive and how people can get, in trouble for their thoughts and their actions and all that stuff. Because a lot of the times, um, even when it comes to testifying during trials, and I've done that several times, right? Um, what do you do when you get a subpoena? That's not something we're taught in school. That's something I had to learn the absolute hard way, and I'm so glad that I did it. Or what happens if as a clinician you end up like you leave your laptop in the car and it gets stolen, like there are laws around that, and privacy and HIPAA laws are huge. And so what happens when it comes to that, part of that system, just that the justice system in general and understanding those parts needs to be more readily available to the public, because for those of us who work in it, we know the things that we'd like to fix and the things that need fixing. And then on the other side of that, it's almost like we leave it there and then people don't have the opportunity to know. So it becomes sensationalized as opposed to this is actually happening right in front of you and you can contribute and help.
Mhm. We have the hand up. Arian, would you like to share your question or comment? Thank you.
Yeah, sure. Um, hey, Dr. Max.
Huh?
I'm curious. You kind of started going into it. Is there something specific that mental health workers or people who aren't necessarily in the carceral system can do to help support like social justice change and support those who are within it?
Yeah, read about it. And I literally mean, I mean, there's so many articles out there. There is I can't remember what it's called. I'm going to Google as we're doing this, but there is a society, this national organization for individuals that are interested in working in like corrections populations, and they have they have like articles and trainings and all of that. um, where you can learn so much about what's going on within the carceral system in jails, what's happening for health workers, and it's specifically for healthcare workers. And for people that are working within that system, but read about that. Take a look at the statistics in the state in terms of who is being affected. That's public information. And then, in terms of if you're looking for careers, if you're not yet in your career, see if that's an avenue where maybe you could even do some volunteer work, understand the populations a little bit better. Because the real difference between working in that population and working in private practice or wherever else you work, where they are when they're in the jails and prisons versus when they're in your office, you may or may not know that they were just there. And that's what I tell a lot of people. They're like, I don't know anything about this. Yes, you do. You encounter these individuals. It's just a matter of whether or not they're going to tell you because they face so much. If they faced a lot of stigma, stigmatization and prejudice and such, if when they were there, if they were there, what's to say that you and your inexperienced self or not knowing, having a lot of experience with this in the outside world, that you're not going to judge them? Stay on top of it, stay educated. Find ways to even, as silly as it sounds, I've actually fostered so many connections with like local law enforcement. I like to call and be like, hey, I know this sounds weird, but for you guys who are students, you'll probably get away with it more than I will because they think I'm they always think I'm an attorney or something, like that. But ask questions like, hey, so I'm a student and I'm just wanting to pick, what's your day-to-day like? What are some of the concerns that you have for this particular population? I'm looking for, to be a mental health professional and perhaps maybe even work in corrections one day. What are some things I should know? You won't even believe how refreshing like it will sound to so many of them who are looking for that. I've been to so many jails. And so many, and I visited so many of the prisons in this state that the number one thing that when they hear I'm a mental health professional, they're like, oh my gosh, yes, we need more of that because they're exhausted. And even talking to some of those who are, behind the cell doors, uh, even just having a conversation with them. It doesn't even have to be like I'm symptomatic right now. It's just like, Dr. Max, thanks. I just wanted to chat with you for a minute. Could you just print me out some coloring sheets? Yeah, totally. And we don't realize just how that's even a touch point. That's an absolute touch point. Um, so stay educated, be educated. Um, I think quit making the carceral world and the justice system something that is ancillary because you realize that the justice system affects the work that we do, both directly and inadvertently, right? I mean, the fact that they're slashing mental health dollars, if you understand, there's going to be some changes to Medicaid in 2027 and, the provisions for who can have Medicaid. Do your
I think
research on that.
this can apply to like every single client population that we work with
Absolutely.
by age,
Absolutely.
by demographic, by experience, identities, all of these things. I looked up some of these organizations that might be one of the ones you were thinking of. Amend is based at the University of California, San Francisco. It's a public health program that creates resources and uh, immersive training.
Mhm.
There's SEICHE, SEICHE, Center for Health and Justice, through Yale University, the School of Medicine and Law School, and the Center for Health and Justice. There's also a couple national commissions, which,
NCCHC was what
yeah,
I was looking for. So yeah, so you can actually become certified or get like a credential after your license with NCCHC. Now, there are requirements. You have to be working in a correction setting for a certain amount of time, but it's for custody staff, mental health, medicine, nursing, and for those of you who are interested in mental health, it's great. But they have conferences. They've got all these different publications. They're talking about, jail-based MAT programs. For those of you who don't know, MAT is medication assisted treatment, or, methadone or Suboxone, all of those for, opioid use. And there's so many different things that you could just even do online, that you could just access online, right? Instead of the 2 a.m. doom scrolling, which is what I think I used to do once upon a time, but staying educated about it. And you're absolutely right, Sarah Beth. I mean, this can work across the board, but there is something about justice involved individuals when I've had conversations with people that are like, that's a scary population. I'm like, is it? I don't know.
And it helps you to understand all the systems
Yeah,
better when
yeah,
you have this knowledge, because you look at education differently, including
yeah.
higher ed. You
Mhm.
you look at medicine differently. You look at access. You look at what laws. I mean, part of this complexity is learning all the changes to the laws that are
Mhm.
happening all the time, and how more harm is being created or more support is possible. So,
Yeah,
something that you often say is that systems don't have to be intentionally harmful to
yeah.
cause harm.
Mhm.
And so I'm curious, how would these forms of injury, the iatrogenic and lexigenic injury, challenge us to rethink not only what we're doing or seeing in corrections, but also how we talk to each other about the people who are living in them.
Yeah, so I'll give a really good example that has affected a lot. It affected the work that was happening, and while I was working at the jail. So in the state of Washington, they made some changes to laws and procedures around uses of force. And for those of you who know about use of force, it's whenever there's a takedown, right, in a jail or a correctional facility. Um, so in terms of like, how can we be really mindful when we err so far on the side of our caution? And I say our caution, sometimes we fail to see the other side of that. Do I think that uses of force are necessary? Sometimes, I'll be honest with you. Sometimes we do have to subdue people long enough to keep them safe, keep ourselves safe. This is why we have things. I'm an instructor in CPI, in Crisis Prevention Institute, so de-escalation training, which sometimes requires that you may have to lay hands on people, but you have to do this with utilizing the least harm, right? Just to get this person under control, especially some of our folks are highly acute mental health folks. But what there was such an outcry about, what happened with uses of force, and we started to see more and more of that because, officers are burned out, there's higher acuity, things like that. And so we swung to this side where it's like, okay, well, when it comes to uses of force in correction facilities or what have you, we have to nix that. And the same token, when it came to uses of force and coming to a scene for our roadside officers, unless the person was actually, you know, causing harm, setting fires, harming themselves, the officers were called to not respond now, which made it really difficult for like designated crisis responders to come out because now they don't feel the safest because they don't have an accompanying officer with them. And so when we swing too far to one side and we don't think about the safety of the individuals that are trying to keep this whole kind of microcosm at a place of homeostasis, then we also are doing injustice to the very people who are trying within that system to keep getting morally injured. Um, so, I think about that example and I think about, I once upon a time would have been situated on the side, we don't need uses of force. And then I think about, I also want to come home to my family, my kids, and my students, and the people that I love. And so sometimes, there has to be a way to sort of moderate the situation in a meaningful, effective way without, you know, um, bringing about profuse harm to people. And outside of that, when it comes to terminology, One of the things I almost plead with everyone to do, if you are thinking about going into mental health as a clinician, one of the best ways I think you can contribute back is, I used to do trainings for roadside officers. Ask if you could even be in a consultative role with law enforcement. A lot of them are so open to that. I don't know if I would have believed that once upon a time. But I also didn't know what I didn't know. And there's an outcry for like, hey, we really need help. We really do want to help people who um, uh, are presenting as suicidal or homicidal. We need to fix our language. We need to know how to engage. We need to know how to assess and screen. Um, you know, Even volunteering to to give up some time or work in the administrative setting with law enforcement. They love that. I was just at the Score jail the other day and, talking with the wonderful people there about some of the opportunities that we might have to help with that sort of transformative approach.
Yeah, go ahead. Do you want to jump in again? Please do.
Sure. I'm curious, in your experience from what you've seen, if you would have an idea when it comes to like uses of force, how often that it would be found to be actually necessary versus when we could be using other techniques. And I ask from a place of like, I just work customer service, and yet I've had to do things like I remember a guy coming into a cafe with a knife screaming at customers, and I just talked to him and I got him to walk outside and walk away. I didn't pull a weapon, I didn't use a threat. It was just like, hey man, let's talk. And like, if that's possible, how many situations are there that present dangerous that could be taken down without actually using force on the person?
Yeah, that's a great question. And this is why I love being a CPI instructor for this reason, because there are so many ways that we can use our words. And I think that we're in a place where, there are a lot of law enforcement officers and corrections officers that much would prefer to use their words, honestly. I want to give a lot of them the benefit of the doubt. Some of them are very close friends of mine. And, but there's also a lot of reform that needs to occur, you know. I think that's also a very challenging question to ask or answer because we never know how people may react. So, right, we constantly, unfortunately, are almost always at the ready. But I always believe in leading with words first. And so just because someone pulls a knife does not necessarily mean that they are an inherent threat. Just because someone is screaming at you doesn't mean that they're not. And so it is very much up to you and those around you to be very vigilant when it comes to your surroundings and know that sometimes we can egg people on. We can egg people on and we can worsen the situation. And so it's, you know, I don't know how many of these events could have been prevented. I don't, that's very difficult, but I will tell you, um, with with where I have worked, there have been multiple opportunities where we have definitely used our words, and it's gotten us to some really great places. And then there are times where nope, 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 nope. And for whatever rhyme or reason, someone just is having a really bad day and they're not able to de-escalate right now. And so we need to help them and in a safe way, to get to that place where they can finally talk about what's going on for them. Yeah.
I want to note in the chat, Brad is sharing
Mm.
that you are an author, and
Oh,
there's
yeah.
another book to come, which is so
Book.
exciting.
Yeah.
And then there's also a podcast that people can tune into and learn more about your work and your ways of thinking. And
Yeah.
knowing you, the way I know you, I know that somehow that work is self-care to you
Mhm.
because you are using using expressions in different ways, your voice and your written voice to share your insights and your learning. But I can't help but ask you, Max, what are your favorite self-care challenges? Because
Yeah,
I know it's not easy with
it's
all that you
not.
do, but I'm the intensity of the work that you do and the way that you are with people. I'm just curious, what have you found is helpful?
I know like we were offlining about this, but and I said in jest to Sarah Beth, I was like, self-care, what is this concept? I don't know what we're talking about. And the irony of being a mental health professional. But to be honest with you, self-care comes in so many forms. And I think especially as I've gotten older, it has shifted, it's changed, and it's only gotten better from here. So I think for me, self-care is work. And in many ways it should be, right? It's working on self. Because to care for oneself is work. But I think it's meaningful work that helps me grow in other parts, really expands other parts of the pie, so that I have more of a more rounder outlook. So um, I taught myself to play the bass 2 years ago, and that is really rewarding, also really frustrating. Yeah, because then you get around what I call real bass players, and they're like, "Ow, but can you do X, Y, and Z?" And I'm like, "Also no." But I can play really well. And I've been a musician pretty much my whole life, so that's a thing. I'm a mom, and momming is not easy. Oh man. And my kids are 15, 8, and 6. And so they all are on different parts of like the lifespan. When does the Dr. Max album drop? You know what? I threaten with several albums and then they just never come. So my album is my book and my podcast. Those are my albums. Catch the episodes every Tuesday. Those are my albums. But I think the best self-care has actually been it's split between writing this dystopian novel and the podcast. I think the podcast is probably the most liberating because I was not a person. I was one to kind of hold it all in for a long time, because that's what I thought you should do. I think, especially as a professional, as a clinician, but I realized that there were people that wanted to heal, and they were like, "It's great and everything that you're helping me navigate through life, but who are you? I want to know who you are with some merit." And so I read something today that totally annoyed me because I love when life does this, when it's just like, you're going to speak on this today. And it says, vulnerability is the highest form of bravery. And gosh, if that's not just so touching. And in my podcast, I'm very vulnerable about being a professional, being a mother, being all of these things, and sometimes not getting the, return on my investment, but the return is that I'm finally allowing myself to be free and not let the heaviness of the work that I do, completely um, define who I am. There's just so much more, and it makes me really happy to put this work out there and that it's mine. I think creation is something that is always one of the greatest forms of self-care.
I love this. Thank you for bringing yourself today, Max. And
Yeah.
always, I've also heard you talk so much about friendships. And
Oh
I
yeah.
know that you
Love my
also
friends.
build those with students. And I just want to say, I really appreciate with all this complexity in your work that you make relationship time and model that. And I think it's so
Absolutely.
important to the collaborative work that is addressing systemic oppression and challenges. So I want to thank all of our audience for attending today and invite you back next week for race, gender, and food. And again, thanks to Dr. Max for being here.
Thank you, Dr. Max.
Have a
Thank
great week.
you.
Yes.
Thanks, y'all.